This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
In a world where our healthcare system has been increasingly defined by protocols and algorithms that dictate how you can be treated, what should be prescribed, what care will be covered, whom you can see, direct specialty care allows me the time and space to recognize that everyone has a unique body, a unique mind, a unique soul, a unique experience of their illness, and a unique story to tell so that I may deliver care that is unique to them in the way that best serves them and their needs. Fostering a sacred relationship of love, trust, and mutual respect requires time, effort, and effective communication, and it's essential to giving my patients the most exceptional care possible. To me, it's my daily opportunity to give love and spread joy through hope and healing. I'm Dr. Meena Julapalli of Bluebird Dermatology and The Joyful Path, and this is my DPC story.
Dr. Meena Julapalli is a Southern girl through and through. She graduated cum laude from Rice University with a BA in Ancient Mediterranean Civilizations. She completed medical school, pediatrics residency, and dermatology residency at Baylor College of Medicine and fellowship training in pediatric dermatology at the University of Colorado. She became board certified in pediatrics, dermatology, and pediatric dermatology and served on faculty at Dell Children's Medical Center and Children's Hospital, Colorado as an assistant professor of dermatology. After practicing for the last 7 years in Austin and Denver, Dr. Julapalli knew it was time to return to her hometown of Houston, Texas. She is proud and excited to help her fellow Houstonians with all their unique skincare needs. As a pediatric dermatologist, Dr. Julapalli has a passion for providing comprehensive care that acknowledges and supports more than just the physical aspects of her patients' skin conditions, but also the social and emotional needs of her patients as well. She believes that when children and families affected by skin disease have a space and community where they feel loved and supported, it empowers and transforms them in profound and life-changing ways. On her journey to become a pediatric dermatologist, Dr. Julapalli has been blessed to facilitate and witness these transformations through her involvement with support groups and camp programs for children and families affected by skin disease. She currently serves on the leadership team of the American Academy of Dermatology-sponsored Camp Discovery Texas, on the Medical Advisory Committee for Paul Newman's Serious Fun Network Camp Roundup River Ranch in Colorado, and is a national board member of the American Camp Association. In addition to her philanthropic pursuits in her local and national community, Dr. Julapalli has also been dedicated to serving children abroad. She has volunteered her time and expertise as a pediatric HIV/AIDS clinic in Lesotho, Africa, at orphanages and schools in Nicaragua, with children and adults with albinism in Tanzania, and most recently with people in impoverished villages in northern Thailand. In her spare time, Dr. Julapalli loves making memories with her friends and family, especially her beautiful nephews. You will often find her fanatically supporting her beloved Houston Astros and Rockets, New Orleans Saints, and Alabama Crimson Tide football teams. hiking up 14,000 plus foot mountains, exploring the world, and being invigorated by all the beauty that surrounds us. She recently traveled to Antarctica to complete her bucket list dream of setting foot on all 7 continents. Enjoying and playing music in all its forms, spreading love and kindness, and being the quintessential kid at heart who always finds the joy in even the smallest of things. Welcome to the podcast, Dr. Julapalli.
Hello. So thankful for you having me on.
Well, I'm also thankful because when you talked about the algorithms and the structured, impersonal, sterile care that exists for patients and exists for medical students and residents going into the world of, working for an employer or working on their own, I love that we are going to talk about something different. We are going to be talking about how you carved out your own place and how you've carved out your own practice and how you've carved, the path that is right for you going forward. So I totally dropped that because we're totally going to talk about the joyful path. And I'm so excited. People turn your stereos up, listen in closely. So, Meena, let's start by talking about how you came to learn about direct primary care and where is your practice located right now?
So it kind of was a little bit I learned from my brother. So my brother is actually a adult gastroenterologist in Houston, Texas. And so he had been just right out of fellowship. He had started his own practice, but he wasn't in the insurance model for I think about 10 years before he decided to kind of go the direct route. So I had a little bit of experience kind of with what he was doing. And there were few dermatologists at the time around the country who were starting to develop their own practices. But for the most part, it was something that I just kind of delved into and started to learn a little bit on my own. And thankfully, there's a lot of like you and so many other like Facebook groups that have come up that just make you feel like you're not starting from scratch because it's not something that we learn in medical school, especially for a pediatric dermatology, which is like a super specialty. Honestly, the only route that I knew was to work in a children's hospital. I didn't know any different. All my mentors had really done that. And so that's just, it was almost like the path was set out for me.
I love that. And let's drop a fact there because this is something I did not know until we were prepping for this interview. But how many pediatric dermatologists are in the United States of America?
There are only about 400 board certified pediatric dermatologists in the entire country. So it's a very super, super, super specialized field.
And, another person that I think of is Dr. Andy Burkowski, who said on the podcast, he's a quaternary specialist because he's the person who people who are specialists in restless leg or sleep medicine send patients to, because, there are complexities that physicians can take care of if they're trained well enough. And you are one of 400. And I get it's an approximate number, fine, but it's like, that's amazing. That's freaking amazing, Meena. Like, I love that you are doing this. And I love that you're doing it in the model which you've chosen to function in under the direct primary care business model.
Well,
so
it's a specialty that actually arose from pediatricians' interest in skin disease. So I actually am triple board certified. I did a pediatric residency, then I did a dermatology residency, and then I did a pediatric dermatology fellowship. So it was a long road, but you know what? Every step of the way, it kind of helped shape how I eventually decided to, build my practice.
And I love that because, especially as we get into your interview, you have not forgotten yourself and the value of who Dr. Meena Julapalli is. And I love that, that everybody comes to DPC as a business model in a different way. But I love that you were just sensing like there's got to be a different way for me to be able to, be a doctor. But also I love that you had some influence by your family member, because it's not everybody who has a family member who's doing insurance-free offerings as a gastroenterologist. So love that. Now, when it comes to you thinking that you could only work in a children's hospital to be able to do your job, where do you think that came from?
Honestly, that's all I knew. And I will say, I always knew that I wanted to work with kids, but I didn't know that I wanted to do dermatology or even pediatric dermatology. It was actually near the end of my med school rotations that I happened to work with one of my mentors, Dr. Levy at Texas Children's Hospital. And that's when I just knew it's kind of one of those things when you just know it's the right fit. These are my people and that kind of thing. And honestly, every pediatric dermatologist that I knew, at least at that time, was all working in a children's hospital. So it's just I didn't really think twice about anything else. I just assumed that that's what I was going to do, and never really had a problem with that. And I enjoyed doing it. I loved working in the children's hospital and kind of the complex cases that I would get. It just, and we'll talk a little bit more about it, but ultimately it came to a point where my values didn't quite align in that setting.
And when you talk about the journey up to this point where you realize that the values weren't in alignment with your way of practicing at your fee-for-service job, and then now, what was your day-to-day like? You said you saw complex cases, but in terms of like, what were the expectations at your job? How many patients were you expected to see a day? How much time was each patient given? And was there a wait to see you?
Yeah, I mean, the typical wait to see someone in a children's hospital, I would say average is probably 4 months. For some people, it's longer than 6 months or even longer than that. And by the end of my time at the children's hospital, in Colorado, I was seeing close to 50 patients a day, so there was a patient every 10 minutes. And the thing about that is, yes, and even then there was a wait time, but I would say on average, the amount of time that I was actually in the room with the patient, because I had residents as well, this is not even an exaggeration. It was probably between, 3 and 5 minutes tops. And, I would go in and I found myself over time, I felt like I was on auto record. A patient comes in with acne or they come in with eczema and click, I hit a button and boom, I just kind of just repeat the same sort of things because that's all you had time for. You didn't have time to really address their concerns, their fears, their hopes, their dreams, how they live with the condition, any of that stuff at all. And so they come in for, a 10-minute visit. They probably wait a while because we're probably always running behind a little bit. And in some cases, depending on where you work, they might have to pay for parking. So they wait a long time to be seen. They pay for parking. They finally get into the room with the doctor. They see them for a few minutes and then they leave and they don't entirely know what just happened or what to do. And then they have to keep coming back because they didn't get that adequate time and kind of assistance in, okay, now you're telling me this knowledge, but when I go home, do I feel comfortable knowing how to take care of myself? And so then it ends up just, they repeatedly have to come back because they never got the time and energy in the first place.
And it's so funny because when we think about, teaching centers, I hear this all the time from my patients. Like, I want the best. I want to go to a place that is well known or has a billboard. And it's like, that doesn't equal quality care. Like that doesn't, I guess, 100% equal. You're going to get the world's best care, right? Like you might have the world's best team in the area or whatever, but there's not an excuse for a 3 to 5 minute visit with a patient, especially adding all the layers that you talked about, not even having the ability to address the things that really truly affect them, not just the diagnosis, but the things that truly affect the patient and their family. Because when you're dealing with kids, it's like there's regimens that parents have to do to take care of the kids. And that's a whole, I as a doctor, like I remember I'd be like, okay, I have 2 hours of sleep because the baby's like less than 5 weeks and I don't even know how to give Tylenol. The basic things like that. It's crazy that
like if a kid isn't sleeping because they're itching all night, guess what? The parent isn't either. So it's not just happening with the kid, it's the whole family. It's the whole family. And to be fair, I mean, the team that I have, the colleagues that I work with, they are brilliant, but the setting is not ideal to give the best care.
Absolutely. And this is why, genius minds like yourself have left that system. And because you're able to do all of the things that you had the capability of doing, but weren't given the space to do or the time to do. So I want to ask there because, when I was in fee for service, there were things that I wanted to do, like, hey, let's automate things so that we don't have to do so many, Medicare physical, fill out the forms while you're in the clinic, or, let's all learn point of care ultrasound because each clinic is given, $5,000 in our local quote unquote market. Like, let's use that money to educate ourselves so we can reduce, stupid reasons for sending people to the emergency room. And that like trying to make a difference, that's something that a lot of us feel, we were just like talking to deaf ears in fee for service. So given that you are practicing in your own private practice and you're able to have longer visits and take the time to discuss the things you need to with patients, what were you doing in fee for service that really tried to move your practice in a way where you could address patients and their families' concerns better. Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yeah, so even from medical school, I mean, it's something that I recognize. Honestly, I say this all the time. I learn more from patients and their families than I will ever learn from a textbook. And so even from medical school, I have been involved with camps for kids with chronic illnesses, in particular in kids with skin conditions. And so there's a camp that I've been involved with in Texas. And when I moved to Colorado, I helped kind of start a family camp because again, like we talked about, it's not just the kids, it's the whole family experience and the siblings experience, especially with a chronic illness. And there was another camp, a winter camp for kids with epidermolysis bullosa, which is a genetic skin disease that is probably one of the phrases that people use to describe EB is that it's the worst skin disease you've never heard of. It's pretty debilitating, but the National Sports Center for the Disabled is in Winter Park. And so they have a lot of adaptable technology that we were able to get these kids whose skin normally sloughs off with the slightest amount of friction. So it's very painful. It's like their skin is constantly burned and can get infected. They are able to ski and dog sled by padding up little ski sleds that they could do. So they were able to do things that they've been told their whole lives that they couldn't do. And so as much as I possibly could, I would refer these kids and their families to these programs because it allows them to be in an environment, a safe environment where they get to do things that they might not have ever get to do. It empowers them with the knowledge that they're not alone, which I think is that realization that you're not alone, I think is the most empowering thing that you can provide a patient. It's an incredible way to give yourself hope and support and encouragement and to know that you're not on this journey alone. And so I would refer my patients to these things. I would also do workshops outside of the clinic, like kind of Love the Skin You're In or like healing circles, which basically I talked a little bit about how to live and thrive with this condition. Because in many cases, conditions aren't curable, but that doesn't mean that I can't support them in a way that provides hope and love and encouragement and allows them to thrive despite of or because of what they have. You know, one of the things that I tell the kids and families that I get to support is that pain and suffering that you're experiencing is going to become a blessing. And they first look at me like I'm crazy. And it's like, no, really, it's a superpower because you're going to be stronger, kinder, and more compassionate towards the pain and suffering of others because of what you've experienced. And the world could use a lot more love like that. And I will say that a lot of these kids get to a point where they finally get it. And then they start to become advocates for themselves and others. And then it actually doesn't matter whether their condition is cured or whether they're healed because they're not defined or limited by it. So these were things that were very important for me to actually feel like I was providing, that I was actually healing the patient, that it wasn't just I'm writing a prescription to give you a Band-Aid for something, because that's just a temporary thing. I want you to live and thrive with whatever it is that you have. And yes, if it's cured and you get better, great. But even if you didn't, I wanted them to feel whole.
Oh, I think that's so powerful. It makes me think about my first experience in a pediatric hospital was at UC Davis, and in child life, there was the 16-year-old who had cystic fibrosis. And, you know, she was well known at this place because, at least on the peds floor, because of her diagnosis. And she was one of the most wise people I've ever met. I mean, she totally owned that she had a chronic diagnosis, and she was like, yep. And these are all the things I'm able to do, you know, with this chronic diagnosis, or these are the things that, you know, I would like to do. So I'm trying to figure out, like, how to do things. Like she was talking about dating, other kids with CF. And it really, really is awesome that you know, we're trying so hard, and now you're able to have the space and time to do those things and really continue to make a difference in children's lives. But when I think about the health of the mental health, especially of children these days, when it comes to that full scope mentality that you brought to your visits, or you tried to bring to your visits, that's so what's needed for every single person, especially in pediatrics. And I shared a little bit about this with you, like my belief in what I'm about to say before we recorded, but pediatrics, people who see kids have the ability to really change the life trajectory of a whole human and a whole family, because you're starting from the ground up. And so I love that the kids whose lives you impact, you're teaching them things that go beyond like, what is the diagnosis of your skin? And that is what I feel every one of us can do under the DPC model, because we're able to have the time to be like, hey, I totally get that, this is going on. It has nothing to do with your hypertension or your eczema or whatever, but it actually still does matter because it increases your stress level. It increases all of these other things. I love the holistic abilities that we have in DPC. And so when you were going from this space of I'm trying to make a difference here, I literally am struggling with how am I also seeing visits that are 3 to 5 minutes long, or patients for 3 to 5 minutes long a piece? How did you come to this point of, this is not right for me, I'm going to do something else?
Because I guess I come from it from an integrative perspective. I love the training that I had. And in many ways, for example, one of the things that really got me to that realization is about 7 years ago, my mom had a spontaneous ruptured brain aneurysm. She was completely healthy before, physically, but what she did have was an inordinate amount of stress at that time. And so I know in my heart that stress was a big part of it. She didn't have high blood pressure, which is, typically the reason why you would have a brain aneurysm, but actually her blood pressure was low, but the stress is what kind of, predisposed her to developing this. And the medicine that we trained in, it saved her life. But what it didn't teach her how to do was to live and thrive in this new state of being where she couldn't physically, emotionally, mentally do the same things that she used to be able to do. And in many ways, the medicine that we trained in gave up on her. She actually was discharged from physical therapy. I'm almost I want to say 2 or 3 months after her brain injury, because she wasn't meeting the national stroke guidelines. And so when I asked the therapist, the person in front of you, it's with the interventions that you're doing, is she getting better? The answer is yes, which should be all that matters. Now, thankfully, we had the resources to be able to seek that extra care outside of, an insurance model. But what about all the people that didn't? And I will tell you, 7 years later, she's doing 10,000 things more than they ever gave her credit for, because of these these standardized guidelines that do not address each of our bodies, our minds, our souls are so unique and individual that it's not going to be the same. In academic medicine, there's such a push to standardize everything. Part of it is to get funding. And so I understand where that's coming from, but we're not robots. Our bodies, most of the time, let's say they do kind of follow the algorithm, but a lot of times they don't. And because we're not robotic, we can't give care that's robotic. And so a lot of what I experienced with my mom, while I don't wish that on anybody, I do think having that perspective of being on the patient side of things, it was a rude awakening in learning the good, the bad, and ugly of healthcare. And so once you've experienced that, you don't look at things the same way. And it just was I wanted to do better. I wanted to do better for my patients, and having both of those perspectives, and already, already trying to do that, but then knowing that this is not the right place for that to continue. And in order for that to take off, I need to do it in a completely different way. And to be honest, I'm not gonna lie, I kind of, when I decided that wasn't the right place for me, when I left, and part of, doing all these programs, I also realized that in that system, it wasn't valued. And, doing these quote extracurricular things to help heal these patients, it wasn't valued. And that's another reason why I knew that. And honestly, it came to be something seeing the most patients that I can in the shortest amount of time possible to make the most amount of money. And when you feel like the way that you care of patients isn't valued and you're more valued for the money that you bring in, it just, at least for me, that wasn't the right place for me anymore. And to be honest, I actually, like, for 6 months, I kind of had a little bit of an existential crisis. I had that moment of, do I still want to do practice medicine? Is this still the right thing for me? Like, what else can I do now? I mean, I spent all these years training, that it would feel like such a waste to not do something. And I actually I traveled the world. I, finished seeing my seventh continent. I went to Antarctica, I hiked the Alps, and then I did a medical mission, spending a month in Thailand. And finally, I think just kind of feeling more centered and grounded in who I am as a person, that never changed. That's always there. And I can bring that into the way that I live, love, and serve in the world. Then I was like, you know what? If I'm going to do this, I'm going to have to open up my own practice. And the nice thing is I didn't have to start from scratch. I thankfully had, my dad, he retired after my mom got sick, but he was always in private practice. My oldest brother was always in private practice. My next brother was always in private practice. And even though their models were a little bit different, I wasn't starting from scratch. And that helped a lot, because I think that that's a hard thing for a lot of people to, like, okay, this sounds awesome, but I don't have the support, the overhead, the funds to be able to go down that route. I still need to pay my bills. I need to put my kids through school and all of that. So I do feel like I had a little bit of advantage in that, to not feel that I was taking a giant leap of faith.
Well, I love that. And, I just want to pull out and highlight, especially for those people who are listening, who are thinking about doing direct primary care or planning their practice. Just what you said, like you hit your seventh continent and you went to the Alps, and, just those things of, like, you literally just like, hey world, like Dr. Julapalli's coming at you, man. Like, think about that. Like, could you translate that into your own lives and be like, Dr. Mandy Dornfeld, she went to New Zealand and, like, wasn't planning on the pandemic happening, but, like, she lived in New Zealand longer than I think she was planning on to. But, I love that you didn't lose yourself. Like, I freaking love that, because it is so, like, yes, we are totally not robots as patients or doctors, but dang, it sure as heck feels like it when it's like what we're valued on, like you're talking about, is how many codes did you bring in today? It's like, I feel, like the idea of, like, the gypsy coyote or whatever you want to call that role, who, like, sends the children out. Like, how many rubles did you bring in today? How many, I don't even know what the lira, like, that's, I'm trying to think of Italian money. Like, how many lira did you bring into? Like, that's horrible. Like, nobody said in medical school, like, and get ready, because once we let you go and be free, you're going to have to bring in as much money as you can.
And you're defined by RVUs and all these.
It's crazy.
Like, I mean, we're little cogs and wheels and dollar signs. I mean,
totally. So when we talk about that, you continued to live your life and plan to open your practice, what was leaving like for you? And do you have any words of advice for those people who are planning or thinking about leaving, looking back on what choices you made in your journey to exit?
I would say that you do it on your timeline. You're going to know when the time is right. My heart knew that I was supposed to leave, like, about 6 months before my brain got there. So I actually really tried, different ways to make it work. Maybe if I worked in a different setting or a different clinic, or, I tried lots of different algorithms to be like, I was living in Colorado. Growing up in Texas, you get, at least in Houston, you have everything you need, but what it didn't have was nature. And moving to Colorado, I realized how much nature was a part of me. The mountains make my heart sing. And that was the hardest part of leaving. I loved being in Colorado, and I still visit it as much as I possibly can. But, just the work setting wasn't the right thing for me anymore. So give yourself that time. Allow your heart and brain to be coherent in the next decision of your life. And it's your timeline. Don't allow anyone to push you one way or the other. And, for some people, the timing is right. And maybe they want to save money and, continue in a situation that they may not like for a little bit, so that they can get to a point where that decision is entirely their own. And that's okay. So I would say, without any judgment, allow your heart and your brain to align in the time that's right.
Love it. And let me ask you this, because you had left a center that had lots and lots of doctors, lots and lots of specialists. Did it matter to the institution that you left? Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Yeah, that's the sad thing. I would like to say that, it was a huge deal for me to leave, but I was replaceable, which is, not a nice thing to feel. I mean, I don't think anybody can replace the way that I took care of patients. I think everybody does that in an individual way. But as a person to see just a patient, it was, they found other people to replace.
A warm body to produce the RVUs. Yeah. And I'm glad that you said that, though. And, it's probably a loaded question. It is a loaded question. But when we hear too often examples of, was there a big, uproar about a physician leaving a practice after 4 years, 20 years, doesn't matter. When it comes to the business model of the fee-for-service clinic, it does not flip and matter if there is someone to, make that revenue up some way else. And that's where we see, people going to non-physician led care. My husband, I've mentioned this on the podcast, was an example of a person who was a physician, rural trained family physician in fee-for-service. And the clinic decided, or the organization that owns the clinic decided to go to a non-physician model. Like that is a thing that medical students and residents and physicians need to hear about, because the idea that you might not matter to the corporation, but you sure as heck matter to your patients, and you sure as heck matter to yourself, and you sure as heck matter to your family, and you sure as heck matter to all of us who are sharing our stories on this podcast now and in the future. So when you decided like, hey, now my heart and brain are in the same position, we are in alignment going forward, how did you actively plan and open your clinic?
There are actually some really wonderful direct care dermatology Facebook groups, which was really helpful because, again, when you're working in a big kind of corporate system, all you do is see patients. You're not involved in buying the supplies that you need. You don't even know what supplies that you need. And even just setting up a phone service, setting up a website, setting up a fax machine. I didn't know any of that. And thankfully, my brother, because he opened up his own practice, he actually, had already done that work. And so he helped me set up my own website and the fax and phone services and kind of the structure of it. And then these Facebook groups helped me to figure out where to start. Now, this is actually an important point. I opened my practice the week we went into lockdown.
Oh my goodness.
So, and to be honest, this is before virtual care was really a thing, very much at all. So I had already planned to do a little bit of teledermatology. I will say now, having kind of delved into it for the last couple of years, it's not my favorite. I enjoy the energy that I feel with patients right in the office. So we kind of discourage it especially for new patients, because I do think that's really important to build a rapport with people and trust, is to have that personal energy and connection. However, that is how we started because we went into lockdown. So that's all I did. I had to do it virtually to start with. I didn't need anything in the office because I couldn't go to the office. So in hindsight, it actually was a pretty nice blessing because I was able to build the practice organically, authentically, and very intentionally, and only spent money on the things that I absolutely needed. And as I was building, that's when I wasn't, deeply in the hole or anything like that. So that was very helpful. And and another thing that I didn't mention that I think is important to mention, I actually did locums for 3 months so that I could, have the capital to I didn't make anything for the first year, at least I have, that capital to support myself on. And, if you have the ability to do that, I think that was another really big help for me to get going, especially because I didn't know a pandemic was going to happen. And so, and so that helped a lot. And I still actually kept my Colorado license. So in that respect, I'm able to see virtual patients in Colorado. And it's funny, actually, I do have a couple of patients who still, even if they don't see me as a patient, they still keep in touch with me because of the emotional support that I give them. So I think that helped a lot. There are so many resources out there now, especially because people are realizing, part of being burned out is when you are in a situation where you don't feel valued. No one's going to value you more than you value yourself. And you have to decide how to create that environment that's going to allow you to feel valued and to have meaning and purpose. And I think that is the key to combat burnout, because that when you don't feel those things, we're burned out. We know that we're not in the right space.
I love that. And it's so important for people to hear that, especially for those people who are feeling burned out, whether that be, the person who's in fee for service or the person who is in DPC. And I say that because there are, these expectations that like, you have to grow quickly. You have to see like, a million people. And I get it. Everybody's finances are different, but even in DPC, that's something to listen to, like, and to have that conversation about with yourself to say like, are you in alignment with how you envisioned your perfect practice, in 3 and 5 and 10 years, especially in DPC, incorporates you as a person. Like I remember Dr. Shannon Scholl, gastroenterologist at GastroDirect in North Carolina. She's like, I would like to be at the beach minimally. I think she said 3 days a week. And I'm like, awesome. Like that was incorporated in her business model. So, the things that we do and how we value ourselves, we get the opportunity to translate how that works for our future lives differently than if we had stayed in a model where, we weren't supported for being ourselves or being valued at all.
That's actually a really good point that you make, is that, and this is going to kind of tie into things that we'll probably talk about later, but I do think it's really important for everybody to really sit and think about what brings you joy, because I don't think we know, because nobody asked that. We don't think about that. So it's actually my favorite question to ask my patients in the clinic. And most of the time they're caught off guard a little bit because nobody has asked them that question. But I think that's an important question to ask from childhood, even through adulthood, because when we are in alignment with what brings us joy, we're going to make those decisions that allow us to actually, again, live, love, and serve in a way that gives us meaning and purpose.
Awesome. So when you opened your practice and, this lovely, ratchet in the spokes of your bicycle wheel of the pandemic happened and you pivoted, who joined your practice? Because the reason I asked this is because we had a big discussion at the Pediatric DPC Mastermind coming in February 2024 is the plan right now. So just keep your ears and eyes open for that, people who are interested in going to that conference, about the AAP and specifically around equity. The AAP, is believed to, at this conference, the discussion was that there's no belief that direct primary care as a business model allows for equity. So, would you say that that's a fair statement? Does your patient population, disprove that? Who has joined your practice and where does Bluebird Dermatology stand?
Well, as we mentioned before, there are 400 pediatric dermatologists in the whole country, most of whom are at children's hospitals. If it takes a 4 to 6 month or plus wait to get in to see someone, it doesn't sound very equitable to me. So one of the things that was really important about me opening a practice is access. So now they have another option to be able to see somebody who's super specialized in something. Because again, there's not very many of us. And at first, I actually did worry that, because it's a cash pay practice, that I wouldn't get to see the Medicaid patients. But to be honest, my practice runs the gamut. I see patients who have Medicaid. I see patients who have no insurance. I see patients who have really good insurance, but they still choose to see me anyway. And it's all across the board. I don't have the exact data, but I would say it's pretty even all across the board. And because it was the pandemic, it was like a grassroots effort. I I couldn't even visit people's offices because, they were doing drive-by stuff. It wasn't even a situation where I could do that. So, this is something I do anyway, but I got out pen and paper and I wrote 100 like handwritten notes to all the pediatricians in the area. Now, I will say I trained in pediatrics in Houston at Baylor College of Medicine. So a lot of my former classmates were still here in the area. So I did have, and the thing is, like, when you go through that kind of residency and you're working 80 hours a week and you're connected for life. So even though I hadn't seen any of my classmates for a really long time, they still, without any hesitation, would still refer their patients to me. But in pediatrics, because, for the most part, at least in Texas, most kids have insurance. It's still a new kind of concept of, because, and I'm sure you've heard this a lot too. Oh, you don't take insurance. Well, it's almost as if, if we don't take insurance, then they're not getting the care for free. Nothing is free.
Oh my goodness.
Nothing is free. It's somebody's, whether it's through your employer or through the government, somebody's paying for it. It's not free. But I will say the beauty of having a direct care practice in many ways is that the people who come to see me are the people who actually want to see me, and they want a different care than they've received in the kind of the traditional model. So, and they already know what they're paying up front when they come to see me. So I don't get a lot of people, they're seeking me because they want a different level of care and a different kind of care.
And to be able to access that type of care, not even just like access the doctor when you need to, but like access the ability to have a doctor who has the time to do all of those things is equity. Like literally that is equity. So if you are a pediatrician or any other doctor who is thinking that like, oh, but is this like, you have to be rich to be able to do this rich in dollars. It's like, listen to all these podcasts. Like they will share with you over and over that is not the case. And this is absolutely an equitable way to take care of our communities, period. So with that, your practice is set up so that you have like your pricing listed on your website and you do visits versus memberships. Is that correct?
Yeah, which I think was kind of, for being so super specialized, that's what ends up kind of working for me. Because here's the thing, when you have the time to spend with your patient for kind of these acute sort of things, they don't have to come back and see you because they know exactly what to do and they get better. So I will say probably 75% of my patients are new patients. So I don't have a lot of follow-up patients, and if I do, it's just kind of checking in kind of stuff. But to go back to, when I was working at the Children's Hospital, I was seeing almost 50 patients a day. A full day for me now is 7 or 8 because I schedule them every hour on the hour. It's kind of funny. The shortest time is actually spent on any prescription or kind of talking about their skin. We spend the majority of the time talking about kind of the daily regimen of how they take care of their skin, how they love, care for it, how they celebrate it, how they honor it, how they manage stress. We talk about nutrition. We talk about what brings you joy. And it's all relevant. You would think it's not, but it actually is all relevant because, one of the things that I talk to when I go to schools to talk to kids about joy, which we'll talk a little bit more later, but I ask them, I say that in order to take care of what's on the outside, it's actually really important to take care of what's on the inside, how you think, how you feel, what you put inside your belly, how you move your body. Because if you take care of what's on the inside, then it's easier to take care of what's on the outside. So all of it matters. It all matters.
I love that. And like you said, I swear to gosh, we're going to be talking about the joyful path, but it's like, I just, for those of you who are listening and not watching, it's like just the ability to do all of those things that you just mentioned. It's like, you can see the joy in your face because it's like, you're free. You're free to do the things that you, as Dr. Julapalli, wanted to do this whole time. And now you're able to. So I just love that. Yeah. So let me ask you there, when it comes to the growth of your practice and the financials of your practice, when 75% of your patients are new patients versus people who are returning because you're like closing the loop wherever you can, how does that work out in terms of how do you look at your practice or recommend to others looking at their practice if they are subspecialists or specialists who are, thinking about, do I do membership versus do I do one-off visits?
Sure. I think it would depend on kind of the chronicity of the things that you see. For me, that's what works because I would say the majority of what I see oftentimes is acute. Now, some of the chronic kind of conditions that I see would be eczema or acne. But again, even with eczema and acne, when I spend upfront, if I have the ability to spend the time and energy to talk to you about the what and the why behind something that you're experiencing, it makes the how part easier. So when they come back and see me, it's just like, you know what? You're doing an awesome job. You're doing great. Maybe we need to tweak things a little bit here and there. So for me, it just made more sense to kind of do it as a, just as they come in kind of model. But for another practice, let's say like if you're an endocrinologist and you're treating someone with diabetes, then it might make more sense to kind of just have like a package. So I think it's kind of just different depending on, and like what kinds of things that you see. I've had people talk to me about, hey, what if you did like if they came in for eczema, what if you did kind of a package for, their first visit, 3-month visit, 6-month visit, through the first year. The only problem that I had with that is that not everybody's the same and they may not need it. So I don't want to have them pay this upfront cost of something. And I don't think that I would, even if they came in, I would still provide them something, whether it's reassurance or, maybe we can tweak a few things here and there. But for me, it just didn't make sense to have them do that up front when I didn't know that they necessarily needed it. Now, I will say the downside to that is that the primary care mostly has a membership model. You know exactly what's coming in every month. So the downside to the way that I do my practice is I don't always know. And so that can be a little bit, unsteadying. But it has also given me the flexibility because I have so many for me, it's worked out for me because I have so many other projects that I'm working on that this model has allowed me to work on that I would never have had time, when I was working, 5 days a week and seeing 50 patients a day, that I'm really happy with the way that it gives me the flexibility to be able to do these other projects.
And you didn't leave medicine because you're able to do, this model of care. Yeah. Let me ask you there, because one of the things you mentioned was like, this idea of closing the loop of full scope care, when your patient comes in, especially if it's an acute issue. For the experience that you had at the Children's Hospital where like, in 3 to 5 minutes, the parents were like, literally, I don't actually remember what Dr. Julapalli said or like what I'm supposed to do. Like, I don't actually remember. How do you make sure that your patients and their families are like on point when it comes to this is what you said, this is what you recommended, this is what needs to be done in the future to prevent or whatever?
So this is what they get. So I schedule a patient every hour on the hour. Now it doesn't always take an hour, but I don't ever want to look at a clock. That I don't ever want to feel like I'm rushing with the patient at all. They get all the time that they need to address all their fears, all their concerns, all their questions. And most of the time they're like, and I probably ask that question, is there anything else that you wanted to bring up or, anything else that I can help you with? Any other question that you have? I probably asked them 3 or maybe it's even more than that to just make absolute sure that everything and they have access to my email. So I always tell them, because sometimes when you're in the doctor's office, you're like, I don't know. I had so many questions. So they can always, contact me afterwards. But I actually tell them that, you don't need to take any notes because I send them, it's almost like a dissertation. It's like a giant after visit summary that basically says everything that we talked about and, has like resources and everything. And that's honestly, that's one of the things that people love so much because they get to listen. And then, some people are visual learners, some people are, auditory learners. And so they get both. And so they have something to refer to afterwards as well. And that's the thing, like, and I say this with the utmost humility. What I'm providing for that, there's no other doctor out there that's doing this. There isn't.
Amen. And again, like you're making such an impact on the whole child, the whole family. Like I think about the world of RVUs, like what RVU is going to represent like the impact that you made on the future of the family. Like there's nothing. So I love that this is the care that you're, again, able to give to your patients, but also that they're receiving, right?
But that time also gives me a chance to do other things. Like, for example, if I had a patient that, needed an injection for her eczema and normally, parents will do it at home, but this mom was like, I can't do it. I can't do it. Can you please, do the first one? And so I knew that they were coming in for that. And I asked the mom, so what's her favorite Disney princess? And she said, Belle. I'm like, great. That's my favorite too, because she loves to read. And so when they came in, I didn't come in as Dr. Meena. I came as Dr. Meena dressed like Belle. And so I was dressed as Belle. I had a rose in there, to give to her. And so, we that in and of itself, I think kind of helped, like, wait, what? She's not like the scary doctor that's coming in. But also, and to be honest, that wasn't enough. She was still freaking out about the injection. And so, we sang together. We used the rose, she called it a breathing rose. Like, we did breathing techniques. We did all sorts. I pulled out everything for this visit. And we finally did it. But I also recognized that it was incredibly traumatic. But I had the time afterwards to recap it with her so that she understood why we did it, what we were trying to do, so that she didn't leave for the visit feeling like that this was something that she would carry this traumatic experience for the next time that she had to do something that was really difficult and hard. And so I wanted her to know, I know this was really hard for you, but you were incredibly brave. And I wanted her to know that she had the tools to conquer difficult things in life, whether it's now or later. And so it gives me a chance to make this experience, because she's going to experience other hard things that has nothing to do with me coming at her with an injection. But, if she knows, I had the time to actually recap this experience so that she can learn and grow from it. And she doesn't carry the weight of it through her, adulthood, where we all have to work on our inner child because of all the traumatic experiences that we've had.
For sure. And I'm going to drop there because it's not like your practice does not just have a costume of Belle. Please tell us about your costume closet.
So the reason why I asked the mom, what's her favorite Disney character is because I have costumes of all the Disney princesses, probably all the superheroes. You need a bee, you need a rainbow, you need the sunflower. I have wiggly headbands, for the little kids who get distracted by just the motion of things. So I've got an entire costume closet. I have a bag of tricks, and it just makes things more fun. And this is DPC. I've always been this way. I'm the one who celebrates Halloween, not Halloween. I during Christmas, if you catch me then, I'm dressed up as a reindeer, an elf, a Christmas tree, candy cane, Santa's daughter, you name it. I might have my ukulele with me. And so
I love it. I love it. For those people who are like, oh my God, I want a costume closet, or I want a bag of tricks. Like Dr. Cindy Rubin had mentioned this particular type of bubbles on that she uses in her clinic. Do you have any favorites that you're like, you should totally look into this?
Oh, I love the little wands that, have the kind of the lights that kind of, it's mesmerizing. It actually really helps. I will say, even without the kind of fancy bag of tricks. So one thing that I help teach kids, whether it's like an injection or let's say they're itching, same nerves that fire that tell your body that you're itching are the same ones that recognize temperature sensation. They're the same ones that recognize vibration. So sometimes we'll use like a little handheld massager, or we'll use a little cold pack. And these are other kind of tips and tricks that kind of help. And even at home, when they're feeling itchy, I tell them to put their moisturizers or their medicines in the refrigerator and apply it cold to the skin. And that's really helpful to kind of, a lot of the kind of the discomfort that we experience can be rewired to feel something different. And so we teach a lot of those techniques, whether it's using your breath or even like tapping or these other techniques that I talked about.
Awesome. Like, as we've been going along and we've been talking about the joyful path, like I want to hit it hard now. So you have had the time to, thrive not only as a physician, but also as the human that you are. And so can you tell us, starting off with, what is the joyful path?
So I mentioned that one of my favorite questions to ask kids is, what brings you joy? And every time I ask that, their eyes light up, they sit up straight, and I've met the most incredible and talented musicians, artists, authors. I had a 9-year-old who said she liked to rap. And so I was like, all right, can you spit some lyrics for me? And she said, I am the best. I am me. I'm the best at being me. And I was like, it takes adults their whole life to learn that. And that at 9 years old. I had a 12-year-old talk to me about sous vide cooking. He's going to be like on Master Chef one day. And I realized that one of my unique gifts is that I've never lost that sense of curiosity, wonder, and awe that I had as a child about the world and everyone and everything in it. And that's something that's an inherent superpower that all kids have, because they think and experience and feel through their hearts. And so one of my missions is to help kids not lose it and help adults rediscover and remember it. And so the Joyful Path kind of began as a way to help kids, everybody, but especially kids, discover, experience, cultivate, celebrate, and share the joy of their unique gifts through programs that help nourish their mind, body, and soul. And so, as a side, I also have, a full-time job as a pediatric dermatologist. I have been, and some of this also came back to, when I said that the medicine that we trained in helped save my mom's life, but it didn't help her live and thrive in this new state of being. Part of me going down this route of finding other modalities of healing was to help her. But in the end, but what it ended up doing was helping me, and also in the way that I practice medicine and the tools and resources that I provide for my patients. So I'm trained in Reiki. I'm learning yoga training, teacher training for kids, heart math, so many other things. Because again, I have this insatiable curiosity. I'm like, oh, I want to learn that. I want to learn this. But one of the things that have stemmed from that. So sometime in the middle of the pandemic, I woke up and I basically gave birth to 3 children's books. I have no idea where they came from. I have never had any ambition to be a children's book author, but there they were. And I was like, okay, what do I do with this? And I actually sat on them for a few years because I realized that I didn't want just any random person to illustrate it. I wanted kids to illustrate it. And slowly but surely, I was meeting all these kids with these incredible talents and incredible stories themselves. So one of the projects, with the Joyful Path is to be able to provide an environment that these kids can showcase their unique gifts. And so I just published a couple months ago my first children's book. It's called Listen to the Song in My Heart. And it's about what it feels like when you listen to that song in your heart. You drown out all the voices that are telling you that you're not enough, that you are too much or too little. And most of that is a lot of times inside your own head. And you listen to that unique song in your heart, you discover the joy it brings, and you celebrate and share it with the world. And it was illustrated by the daughter of some classmates of mine who struggled a lot in school. She felt bullied. She just didn't feel like she quite belonged. She didn't have a lot of friends, didn't feel like she quite connected. Everybody kind of just chalked it up to her being shy and anxious. And during the pandemic, she decided to teach herself how to watercolor paint through YouTube and realized that she was actually really good at it. So, and they also recently discovered that she has high functioning autism. So even though she has difficulty communicating in words, she learned that our most joyful way of sharing what's in her heart is through her artistic expression. So she literally listened to the song in her heart and put it on the page, and I couldn't be more proud of her. And that's just the first one. I've mentioned 3. So I guess once you get started with these creative things, they just keep coming out. And so I now am in the process of editing 2 others, all of which have been illustrated by other kids with amazing stories in and of themselves. I have 2 more being illustrated right now and another 3 in the works. And I don't know, I'm just going to keep going. So that's one of the things, but I'm also going to, because of this book, I've also been able to go to schools. I don't read the book, I sing it because it's called Listen to the Song of My Heart. So it's a song. And so I wait till the very end to tell the kids that a kid illustrated it. This is my favorite part, because every time I say that, I look out into the crowd, I look into their eyes get really wide, and what I see in their eyes is possibility. And that's exactly what I want them to feel, so that they feel like, oh my gosh, a kid did this. Maybe I can do something. That you don't have to be a grown-up to make a difference in this world. You just have to figure out what it is that allows yourself to shine. Because each and every one of us has a unique gift. There are no exceptions. And so it's just been really fun to be able to go out there and talk to these kids about joy. And I said I had a costume closet, right? So it's, the main character is a bluebird. So I dress up as a bluebird when I go in. And so I've got wings and everything. So when it's funny because it's received in different ways. So when I do it with preschoolers or kindergartners, they don't really have questions. They have comments. They always like, can you really fly? Are you really a bluebird? Do you have wings? And then, but the older kids, I love the questions that the older kids ask, because one of them asked me, did you ever worry that people wouldn't like your book? And I loved that question, because we've all been there. We all feel rejection. We all feel failure. And in that moment, the answer to that question was no, because I didn't write it for anyone else. Yes, it's a children's book and it's for kids, but it's something that came out of my heart and soul. And when you create something from your heart and soul and you put it out there, it grows wings. And I guarantee there's someone out there who's going to receive that message, who needed to hear exactly what you had to say. So the measure of success is not how much money you make or how many likes you receive or how many books you sell. It's that you made a connection. And it's fun to watch these kids kind of experience that. And then I had a 6-year-old who had a question. He was kind of stuttering a little bit and he was kind of nervous about the question. And then he got the courage and he looks me straight in the eye and he says, "What makes you happy?" And all the teachers were like, "Oh," and in that moment, I was like, don't cry, just answer the question. Because in that moment, what I understood, not only did he understand the message of the book, which is, kind of being in tune with what brings you joy. In that moment, his empathy came out and he wanted to know what brings me joy, which was like, great, that's what the next book is about. It's about learning what others' joys and celebrating those with them. And so it's provided a platform where I'm hopefully going to build kind of workshops and after school programs. And ultimately, my grand vision is a wellness center for kids. So, that's where all this is going.
Awesome. And every time you talk here on the podcast at a school with your patients, you're continuing to build that dream. Like it might not be a physical space in terms of like a single building, but like you literally are building that every day. And I just think about, as you were talking about how like you just woke up and you just gave birth to 3 books. I think about how your heart and brain were not in alignment, for a few months there before you left fee for service. And that was probably what happened also, that like your brain's like, like that's what you've been trying to say, heart. So I love that, that this is where you are in life and this is where you're going and this is what you're bringing to the world. So, with that, I want to close by, do you have words of inspiration in addition to everything you've already shared for those physicians out there who are, exploring doing direct primary care as a business model, whether it be in primary or specialty care?
Yeah, I mean, it's going to sound so cliche, but a lot of it just has to follow your heart. I mean, it's one of those things that if you listen to the song in your heart, you're going to know how to build this in the way that helps serve you, in the way that helps you find meaning and purpose in what you're trying to do. I'm going to tell you like kind of one more story because it kind of allows me to integrate all the things that I've been training and putting it together. I had gone to this week-long meditation retreat where we probably meditated for about 40 hours. So I came back and I was still, my heart was open. I was still in this floating state. And the very first patient I saw was a 6-year-old girl who had eczema that I'd been seeing for quite a while, and ups and downs. But in this moment, when I walked into the room, I just felt the energy of the room, just like it felt hopeless. It felt defeated. There was so much frustration. Mom was telling me that she was calling herself a red monster, that, they weren't sleeping because she was itching all night. And in that moment, again, I listened to my heart. I was like, I think this is what we need to be doing. And so I had them kind of get into a circle and I had them kind of start to breathe into their heart, in and out of their heart a little bit more slowly and deeply than usual. So I was using kind of heart map techniques to kind of get them in sync. When I could feel that our energy was in sync, then I had her breathe in love into her heart, breathe out fear. Breathe in light into her heart, breathe out doubt. Breathe in life into her heart, breathe out limitation. And then I had her send that love and that light to her skin. Because so much of life, we're always thinking about, why am I not healing? Why am I not getting better? Why is this not working? Same in kind of our profession, like, I don't get it. Why is this not, like, we're always kind of focused on all the things that aren't working out for us instead of what can we do to be in the best state of being to already feel healed. Envision what it is that you want in your life, what brings you joy, and be in that state of being, and those other things will start to align. And then I had her send that love, light, and life to her mom for taking care of her, because there was so much mom guilt coming from there that I wasn't doing enough to take care of my child. The entire energy of the room shifted. Mom was crying happy tears. She had this huge smile on her face. She gave me this huge hug. But the best part of it was, a week later, Mom sends me a message saying that she's doing this exercise that you taught her. Every night before she goes to bed, she's inviting me to invite kindness to my heart for taking care of her. She became so empowered that she decided to write a story about her eczema, how it makes her feel, what she has to do to take care of it. She shared it with her class. Her teacher was so moved, she asked her to share it with her school. And now this 6-year-old girl who used to be bullied walks the halls with confidence. She is admired for her courage and bravery. Oh, and guess what? Her eczema is better. I didn't do that The medicines didn't do that. She did that, and she knows she did that. And she empowered herself to create her own story where she wasn't defined or limited by what was on the surface of her skin. And I actually, a couple weeks ago, I had a workshop where I was teaching kids the power of creating your own story. And I actually had her as a she's now 7, but I had her lead the exercise. Because it's one thing coming from me, it's a completely other thing coming from another kid who's in that leadership role to say, hey, this is what I did, and you can do it too. And so I share that story because I think we've all been in that place where we're so focused on, like, we're at the bottom of the mountain. Oh my gosh, it seems so daunting. There's no possible way that I can change what's going on in my life. And I think it comes back to listening to that song in your heart, like really sitting and intentionally thinking about what is it that brings you joy, and then create the environment that would allow you to manifest that.
So with that, just know that you can find Dr. Julapalli's first book, and hopefully we'll get the other ones on there as well in the future on the accompanying blog to your podcast, and you'll find the Joyful Path link as well as the link to Bluebird Dermatology. But I humbly thank you so much for sharing your story and for all of the amazing stories that you've shared about the patients you've taken care of. It makes me so happy to hear that. And I hope it has, brought inspiration and joy to so many people who are listening to your story today and in the future.
Thank you so much for having me.
Next week, look forward to hearing from Dr. Emily Scott and Dr. James Gaor of Halcyon Health DPC in Irvine, California. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now, as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media at MyDPCStory. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.